Hello, my name is Alex Flood, and I'm a radiographer and healthcare educator. Um, Currently, I teach two programs. I teach clinical medical assisting as well as a limited permit X-ray technician program in Central Coast in California. And today I'm here to talk with you guys about medication administration, specifically a type of administration we call parenteral administration. So know that there's, roughly speaking, three ways that patients can be given medicine from a physician. A medication can be administered, that is given to the patient at the office, prescribed, where the physician would provide the patient with a handwritten or computer-generated prescription to be filled at a pharmacy, which can be telephoned or faxed or electronically transmitted, or dispensed. The office may give the patient drug samples, or may have an in-office stock of medications to dispense to the patient. Some legal aspects to consider. The main one is that medication is administered only under the direction of a physician. It is, of course, unlawful to administer medicine without a physician's consent. To start with, before we get talking about actual medication administration, we should get familiar with the way medicine is measured. And know that three systems are used in the United States for medication administration, prescribing, or dispensing. We have the metric system, which is most often used. It's the most accurate measurement system. I'll explain why in a moment. The apothecary system, used occasionally, or the household system, which is least accurate but works really, really well for patients taking medicine at home. So the metric system. The units that we need to be familiar with are units of weight, volume, and length. More specifically with weight, when we get into the metric system, you'll learn that it's going to be a unit of mass. Weight and mass, for our purposes, can be effectively interchanged, although they do mean different things. Volume is the amount of space occupied by a substance, and length is the length measured, the linear measurement of distance from one point to another. We don't use length to administer medicine, but it is a consideration, for example, when you're selecting needle lengths. So the metric system. It's the most often system used to administer medications. It's been around for several hundred years. It was developed in France in the 18th century, so the 1700s. And most European countries, as required by law, use this system to measure the basic units, weight, volume, and length. The metric system is used for most scientific and medical measurements simply because it can be very, very exact. Pharmaceutical companies use this system to measure and label medicine. And it works well because it is a uniform decimal scale based on units of 10. So the units to be familiar with: the gram, the liter, and the meter. The gram is going to be our unit of weight. If I can be specific, the gram is a unit of mass. Mass is how much stuff is something made of. Weight is how much something weighs on a scale. Weight is dependent on a gravitational field. So, for example, your mass remains the same if you were to fly to the moon, but your weight would change. You'd weigh about 1/6 of what you do here on Earth. The gram unit of weight is used for measuring solids. Medications are measured in grams or usually milligrams. The liter is a unit of volume for measuring liquids. Think of a Nalgene bottle, those clear water bottles with the graduated markings on them, clear plastic water bottles. A liter in size. A liter is a typical measurement. You guys are probably all used to getting 2-liter sodas at the store, so we know what a liter is. The meter is a unit of length for measuring length and distance. To give you something to reference, the meter is very similar to the yard, which is 3 feet. A meter is, roughly speaking, 3 feet 3 inches. More commonly used units, simply because it's difficult to measure things in full grams. A gram is actually a fairly large unit when we're talking about medicine. A gram is roughly the size of the weight of a paperclip. So we commonly use the milligram. The prefix of milli indicates 1/1000th. So a milligram is 1/1000th of a gram. The gram is the full unit, and then the milliliter, milli showing its face again, milli for 1/1000th, so a milliliter, 1/1000th of a liter. Cubic centimeter, it's a unit of volume. It's an amount of space, right? It's the amount of space that would be occupied by 1 milliliter. Okay, so for reference, take a look at your pinky finger, and specifically your pinky finger's nail. Your pinky finger's nail is about 1 centimeter wide. So imagine a box that is made out of something the size of your pinky finger nail. Some abbreviations to be familiar with. Microgram, little m, little c, little g. Milligram, little m, little g. Gram, little g. And kilogram, little k, little g. Abbreviations for volume. Milliliter, little m, big L. Cubic centimeter, little c, and liter, uppercase L. You should also be familiar with the fact that there is a potential for adverse reactions with medication administration. These are unintended and undesirable effects that occur along with therapeutic effects. Therapeutic effect is the good effect, that the thing we want the medicine to do. The adverse effects are things we don't want the medicine to do. Adverse effects can be harmful. They can possibly cause the patient to have to discontinue the medicine. They may also be harmless, referred to as side effects. The adverse reaction to get familiar with is the the allergic response reaction. Often mild, things such as rash, rhinitis, or pruritus. In the worst case scenarios, we worry about anaphylaxis, a serious allergic reaction that requires immediate treatment. This is least common, but most serious, and this does occur very quickly. When you're administering medicine, you need to follow the 7 rights of preparing and administering medicine. You need to think, do I have the right drug? Do I have the right dose? The right time? Of course, do I have the right patient? Do I have the right route? Am I getting this medicine into the body in the right way? Do I have the right technique? Is there anything special that I have to do for this route? And did I document it? Of course, we say in medicine, if it wasn't documented, it didn't happen. Okay, so now to actual parenteral administration. Big advantage is it's absorbed more rapidly and completely than the oral route. That's probably the main advantage. It gets the medicine quickly into the body. It might also be the only way the medication can be given, like insulin and some immunizations. Medical assistants are responsible for parenteral administration typically. That's by routes of subcutaneous, intramuscular, and intradermal. IV administration, when immediate effect is needed, is administered by the physician. In our ambulatory medical practice, it's not typical for IV medication to be administered. If that is the case, it's likely to be an emergency, in which case the physician does all of the actual administration. You can assist them in preparing things, but you cannot administer IV medications as a medical assistant. Disadvantages. Pain is the primary disadvantage. We minimize pain by inserting and withdrawing the needle quickly and smoothly. Needle comes out at the same angle that it went in. The other main disadvantage is possibility for infection at the injection site. This is why we practice medical asepsis. Which brings me to that point, medical asepsis. The needle and syringe inside of the syringe must remain sterile. This reduces the possibility of transferring microorganisms to the inside of the patient's body. Our skin is one of our primary barriers, one of the first lines of defense for our immune system. If we can just keep things out of the body, that can prevent infection. So, the practice of medical asepsis takes steps to keep the infectious organisms from getting into the patient because of something we did as a healthcare professional. You should also follow OSHA's bloodborne pathogen standard. This is to protect yourself from potential bloodborne pathogens from the patient. Okay, now on to our needle anatomy. So every parenteral administration requires a syringe and a needle. The hub of the needle is basically the end of the syringe the end of the needle where the syringe and needle meet, and usually lock together in either a push-on or twist-on fashion. The shaft of the needle is the long part of the needle that's inserted into the body, and the lumen is the opening, the bored out opening of the needle. It's what the medication travels through. The point of the needle is located at the end of the needle shaft, and this is the sharp part that's used to penetrate body tissues. The point of the needle is made by taking that small metal tube, the small metal shaft of the needle, and slicing it at an angle to form a beveled tip. The bevel is located at the point and is slanted. This makes a narrow slit-like opening in the skin, which allows the skin to close quickly and heal quickly. Needles range in their size. The size of the needle is given by the size of the opening, the diameter of the lumen, as well as the length. The diameter of the lumen is given in a unit called gauge. Gauge size commonly runs between 18 and 27, and gauge runs inversely proportional to the size. So a large number equals a small opening. Medications that are thick and oily should be given with a large lumen. So this is something you'll have to select. Do you want the medication given through a large lumen or a small lumen? Know that small gauge sizes reduce pain and tissue damage. Large gauge sizes increase pain and tissue damage. So you have to weigh these things. You know, if you have a thick, oily medicine, a large lumen might be the only way to get it done, but it might be a little bit more uncomfortable for your patient. You have to make an educated decision here. Needle length runs from approximately 3/8 to 3 inches. The needle length is based on the type of injection and the size of the patient, right? The needle has to be able to get to the tissue that you're injecting the medicine into. So must be longer for IM injections in order to get into the muscle tissue. The syringe itself. The barrel is the main part of the syringe. This has graduated calibrated markings, calibrated in either milliliters or cc's. Again, for our purposes, milliliter and cc effectively can be interchanged. Just remember that they mean different things. Cc is an amount of space. Milliliter is an amount of fluid that would fit into that amount of space. The flange is the rim at the end of the barrel. This is what you can sort of grab onto as you're pushing down on the plunger, which of course is the movable cylinder that slides back and forth inside the barrel. This is how the medication gets into and out of the barrel of the syringe. So let's start off talking about one of these three different types, subcutaneous injections. You can refer to your skin as cutaneous tissue. So subcutaneous tissue is just the tissue underneath the skin. It's fat or adipose tissue. You have it everywhere. Certain sites are more commonly used than others, where bones and blood vessels are not near the surface. Common sites: upper lateral arms, anterior thigh, upper back, or abdomen. Any medication given by subcutaneous route must be isotonic, not irritating, not viscous, and water soluble. And in general, you don't want to give a large dose, nothing more than a milliliter. Medication is administered subcutaneous. Good examples of these are epinephrine, insulin, and allergy shots. Intramuscular injections. These are administered into the muscular layer of the body, located below the skin and subcutaneous layer, and the special technique is to insert the needle at an angle of 90 degrees to the patient's skin. The amount that can be injected varies depending on the size of the muscle you're injecting into, whereas subcutaneous, we just said no more than an ml no matter where you're at. Muscular injections vary depending on the muscle. The gluteal muscles, the butt muscles, and the vastus lateralis, which is like your thigh muscle, outer thigh muscles, you can put up to 3 milliliters in an adult or 2 milliliters in an old patient or thin adult. The deltoid, which is your shoulder muscle, no more than a milliliter. Most parenteral medications are administered intramuscular. Good examples of that done in the medical office: immunizations, antibiotics, birth controls, contraceptives, B12 injections, corticosteroids, all can be done IM. The needle length gets longer, somewhere between 1 and 3 inches. It needs to be long enough to get into the muscle tissue. The average length is about 1.5 inches, shorter for children or adults than adults, and longer for larger obese patients. Gauge size runs from 18 to 23 for this injection, depends on the viscosity. And injection sites should be located away from large nerves and blood vessels and should be fully exposed. Intradermal injections are administered into the dermal layer of skin between the epidermis and dermis. The angle of insertion is parallel to the skin or nearly parallel. And the absorption is slow, so we can only give a very small amount, somewhere between 0.01 and 0.2 milliliters. You got to do it where the skin is thin, so not calloused skin. Anterior forearm, middle of back, or upper arm are spots where this can be done. Needle length does not need to be long. Only the lumen of the needle needs to be introduced under the skin, so 3/8 to 5/8 of an inch, and a gauge from 25 to 27. This is most commonly used to administer either allergy skin tests or tuberculosis skin tests. The medication is injected until a wheal forms. WHEAL wheal is a small raised area as a result of distension of the skin. Thank you for paying attention through all of this. Hope you learned something or it was good review for you. Please check back next time for more videos on my clinical medical assisting skills. Thank you.